All right. So, welcome to the Business of Allied Health series. This is not actually a podcast, it's supported by CliniScribe, my AI scribe company. So, we have a very special guest today. He's Ben Corso. He's been in our industry for 33 years. Apparently, he was one of the last manipulative physiotherapy masters graduates. Not sure what it's like these days, but he's still involved in our industry. He founded and grew his own clinic called the Physio Clinic for 23 years and sold out to a large corporate, Healthia. He was also, executive at Healthia, managing a portfolio up to $40 million in revenue. You can correct me on that later, Ben.
Thanks, Barry. Thanks for the introduction. No, you've nailed that. I think you've got most of that spot on.
No
I'm a
worries.
bit worried about the number of years you're quoting that I've been in the industry. That'll show my age.
But yeah, so we kind of share the same battle stories early on in our careers.
Yeah.
I'm not going to go into that detail here because this is the audience of practice owners. But yeah, tell us about your story quickly around how you started that first clinic, like that
Yep.
founder journey, how you ended up exiting to a publicly listed company,
Mm.
Ben.
Yeah, thank you, Barry. I guess when I graduated from physiotherapy, I was pretty open to working in a whole range of areas. A graduate's fine. They maybe enter into physio thinking they want to be the physio for the Australian cricket team. And then they sort of quickly realize that might be limited scope of practice, minimal job opportunities, and there's a whole range of other things you can do in the industry. So I graduated, took some early advice, and went and did a whole range of variable type jobs to get experience. So, working in the public health system, working privately for other practice owners, traveled overseas and worked overseas in both public and private settings. And then after 6 or 7 years, thought, yeah, look, I'm really ready to upskill now and probably focus on an area. And that I landed on musculoskeletal and orthopedic type physiotherapy. And as you said, I did the last MINIPS program in Adelaide back in 2002. And that was a great experience and really just learned more skill set and confidence to then open my own practice. So, as part of that program, I ended up doing a placement in a medical centre and in the musculoskeletal ultrasound centre because I was interested in shoulders and musculoskeletal pain and worked with a specialist doctor in ultrasound and just happened to be in a medical centre with a room with rooms next door that were vacant. And at the end of the master's program, I inquired and ended up renting a room a couple of mornings a week on my own. So that was back in 2002. Fortunately, through the public health system work, I'd had a lot of orthopedic contacts and referrers. And it happened that at the time I opened my practice, some of these orthopedic referrers had just completed fellowships around the world and had come back to Adelaide to start practice. So essentially, they started referring to me both in an inpatient role and also an outpatient clinic. And that got me started. And so over then the next 20 years, I sort of grew in size, employed more people, both admin and clinicians, changed locations a couple of times, rebranded, built a clinic from scratch, a purpose-built clinic, which still resides in Prospect. And then from there, ended up scaling and opening multiple sites, all off the back of other opportunities. So opening a site at Blackwood, which again is on Main Road, Blackwood now, opening a site at Marriotteville. And so over 20 years, I obviously went through the journey of growing, scaling, how to look at the business performance and optimizing that at all times with the focus on best patient care, best patient outcome. And then the opportunity to look at realizing some of the value in the practice came through some discussions around benchmarking and looking at performance. And that led me to the journey to sell a component of the practice to Healthia in 2021. And then, as I said, I remained on in a general manager, group partner, regional partner type role, helping them manage clinics across the country, which served me well as far as experience. So I've now come to the point of looking to, I guess, extend my advice and expertise across the industry more broadly and outside of Healthia and outside of my own clinic and make myself more available to all others in the industry, not just in physiotherapy, but in allied health in general.
Yeah. So was that your original goal to own a clinic when you started physio?
It's a really good question. Probably not before I started physio. Perhaps whilst I was undertaking the program, I got a sense of what the industry looked like from a private practice, public health type sphere. So it was probably only the interest through my student experiences and then probably early on in my career working with other practices and practice owners and getting a sense of the way things were run and how they went about doing things. And then probably from there, you start to formulate your own philosophies and your own goals around what you'd like to see happen, the way you would do things, the decisions you would make if you had that opportunity. So it probably grew, I would say, Barry, over the period of studying and in those early parts or that early part of my career. But it certainly wasn't a goal or a quest from the outset.
Right. And did the public sector help you at all in terms of skills, experiences, or learnings to
Yeah.
run a successful commercial operations?
I
Or
think
did
it's
you formal education or study
yeah,
or had mentors around that, given your success today?
it's a great question. I advise all younger physios when they're looking at their options to keep the public hospital option as an active and engaged option. And the reason I say that is that, as I spoke to earlier, my experience working in a big public hospital gave me great grounding in general experience across a whole range of areas. And things like having a much better understanding of the medical presentations that you see in a public hospital indirectly do help you in private practice because you will see those patients come through with significant medical history, significant medication lists, and getting that knowledge or gaining that knowledge in the public system certainly helped my outpatient practice. From a business point of view, the indirect benefit was the contacts that I mentioned. So meeting and working with a lot of medical specialists that were often in their training programs as registrars and what have you, while you're a younger physio, they are still some of the contacts that 20, 30 years later have continued to refer to our private businesses. So it can't be underestimated the value of that experience publicly, both from a clinical training perspective and knowledge perspective, but also from a business perspective through broadening your contacts and network. In business itself, things really changed for me when I grew over the first 3 to 5 years and then did actively engage a business mentor. So somebody who probably was able to open my eyes to the world of scaling and what branding meant, what targeted marketing really looked like, and certainly gave me a lot bigger perspective than I had as to what the practice could look like in the future and what was required to actually get it there. So I think initially when I opened my practice, I didn't envisage it much more than one big practice that had multiple team members and provided great care. But certainly the business mentor was instrumental in taking me from that idea to, well, how about replicating it? How about expanding it? How about being able to offer more to more people, including your team, across different sites and locations? So I think you have influences from everywhere, and I think being in practice can be lonely, and I think it is important to seek out support and advice when you need it.
And how did you find that mentor? Was it from your own network? Was it from the industry?
Yeah, no, this was not from industry. I was very fortunate that the area that I ran my practice in was part of the Adelaide City Council. And the Adelaide City Council at the time, and this is another important tip, to look at what's available for you as a business owner in your community. And you'd be surprised that there are often multiple opportunities to gain training, networking, and experience within the community your practice is in. So this was exactly the case. The Adelaide Council, City Council at the time, had a program called Enterprise Adelaide, and it was a funded program for the council to support small businesses in Adelaide. And so part of that was you were assigned a business mentor or advisor that you could work with. And that's how I engaged this fellow. He was not from specifically from health, but he obviously had a fairly broad business background. And I worked with him initially under that model. And then when that model finished up, I continued to use him privately on an ongoing basis.
That's fantastic to hear. I mean, a great insights there because that brings in another perspective that we often
Yeah.
don't think of,
We,
like that tribal sort of narrow view we have about who should mentor us.
I think, look, it depends what you're looking for. I mean, I think there's mentors in all spheres. If you want a clinical mentor, obviously that's probably going to be someone coming from within your industry to help upskill you in the clinical side. With a business mentor, like I think it's actually really important you keep that broad. I think it's good to have someone from within the industry that has gone through the process that you maybe want to, but it's also good to have some people from outside the industry because they come with a different lens and they can challenge your ideas and challenge your thinking. And I often found my business mentoring sessions, whilst they were really, really good, really positive, I found them challenging. I found them a bit uncomfortable at times because they were really testing me and almost pushing me in a direction that I wasn't resistant to, but I just hadn't thought about or didn't know a lot about. But of course, that was the point, was that they were there to try and challenge me. And then when I was pursuing an opportunity or an option, they were also there to keep me accountable. And that was really important to have somebody that keeps you accountable.
Yeah, I'd actually agree with that. I mean, I'm in tech now, and my key mentor now makes me feel uncomfortable every time he
Yeah.
emails me.
Yeah.
He's all about metrics. He's a
Yeah.
three-time Y Combinator alumni from
Yeah.
Silicon Valley. Like,
Yeah.
totally different view of the world, and
Yeah.
it's very
And
challenging.
And I think it has to be. I think you can look at the reasons you engage a mentor or an advisor or a coach, whatever you want to call them, and they might be multifactorial. But the clients that I work with now, like there's a combination of those that are just looking for someone to talk to because private practice is lonely. They just want someone to throw their ideas by, and it could be anything from what should I call my practice to how should my signage look to how many rooms should I set up in this clinic when I'm looking to fit it out, to how do I recruit the next physio, all the way through to, look, I'm looking to exit in the next month. I've had someone approach me to purchase my practice. Can you support me through this process to give me an indication of what the practice might be worth? What do I do on the other side of the sale? How does that influence things? So the advice is very broad, but these are the genuine areas that most practice owners need support and help with. And I think someone who's a trusted advisor that's been through the process, I think can be very valuable.
Great. And for you personally, what was the biggest, earliest challenge you had building your own clinic?
Look, I think the first one, which often can remain throughout your practice days, is your time management. So that was probably one of the biggest early lessons, was how to manage my time effectively across the day. I would, on some days, be going from hospital visits early to one clinic to then a second clinic all in one day. So that made for long days. But it was probably more a realization about efficiencies, using your time well, making sure that you've got the right headspace to focus on the work you were doing to be effective and get the best outcomes. So from a personal point of view, it was probably time management. From a business point of view, it was really that challenge of going from one size to then increasing to the next size and beyond, and having the confidence and the strength to and the commitment to doing that. And that's where the business advisor was important. I don't think it was because I doubted our service or the quality of what we were doing, but when the opportunity to expand or grow is in front of you, one thing is you can do is you can focus on the negatives or the costs in this case, and maybe not look at the potential outcomes. And I think, to my earlier comment about feeling uncomfortable or risk, a lot of those decisions at the time were at that level of discomfort or felt somewhat risky, but more like a calculated risk. And my belief is that they they almost have to feel that way for them to give you the opportunity to have a successful outcome. If
This
it
is
was easy, everyone would do it.
Absolutely love that insight. That's gold.
Mm.
So, what is one key metric you do measure in a successful allied health business, or what should practice owners measure? If it was just one, I'm sure you have a lot.
Yeah, look, it depends how micro or macro you want to be. I think from a cultural perspective and a service delivery, I think having some metric around your staff satisfaction, your business is important. So you can keep your finger on the pulse. Whether you do that through performance reviews, check ins, formal assessments, confidential feedback forms, getting a sense check on your team culturally is important. Likewise with your patients. So getting a survey on their satisfaction, their willingness to refer others to your business is important. So they're all the sort of cultural elements. Then you've got the quantitative elements. And I think there has to be both, which is why I mentioned those cultural elements first. For me, probably the biggest one is to have a really good understanding of your numbers. And I don't mean things like just your diary occupancy, just your retention numbers, rebooking rates, early self discharge, numbers of new patients. I mean, they're all important and they are all things that could and should be monitored for a healthy, successful practice. But I think what's also important is that you know your financials that underpin that. And I see a lot of clinics that know their revenue. So they know how they're going from a revenue point of view year on year, but they don't necessarily understand the benchmarks by which they should be measuring their wage costs, both clinical and admin, their occupancy, their rent, and probably the biggest metric is they don't necessarily understand their profit margin and how much profit they are making month on month, quarter on quarter, year on year. So I encourage all of them to, at least through their accountant usually, is to set up what I call a really clean profit and loss statement. So that's one where they are taking out an appropriate wage for the time that they're spending, a market rate for their time. They are not including things like add backs, which are one-off or discretionary expenses that happen, and run that P&L to get a good understanding of how well that business is actually performing from a financial health perspective. So that would probably be my number one metric, because we get very drilled into what's happening at that micro level of patient numbers and retention. Again, all important information. But how that looks at a macro level in terms of your actual financial performance, I think is often overlooked or not well understood.
Well, that's you very unique insights there. I always hear the other metrics.
Yeah. And so
Yeah,
I think the focus of my
yeah,
consultancy at BAC Business Consulting is that's often the point we start with. We start with a health check, a business health check. And I ask exactly those questions. Do you have the last 3 years' financials? Do you have a clean P&L? Do you understand the industry benchmarks? So I'll start with those questions, and that gives me an insight into what the business does have or the business owner does understand, but it also gives me a good idea of what areas I can help them with most. And so with the business financials, I make myself available through a non-disclosure agreement to work with their accountants and their financial people to really extract the right financial numbers and use that information to help them build, optimize their practice. And then when it does come to the day that they want to sell, which could be 3 to 5 years or 10 years away, everything is set up well and they are in a position to be able to track their performance in a more measured way, and even to the point where they could almost predict the potential value of their practice. And that's another thing that I find most owners don't know, is what value they actually hold in their own business.
very, very interesting. So looking basically at your business as a product to an
Oh,
investor
as it,
or yeah,
yeah, I call it looking at your business as an asset. So have you spent the time building a job, or have you actually built an asset? And in many cases, you have actually built an asset. You might just not realize to what extent, or how you might be able to fine tune or tweak things to create more value in that asset over time. And that, as I said, can occur really successfully and ultimately help the business owner set up their future for some freedom from the business, but also some return on their investment in terms of all the blood, sweat, and tears that goes into running and managing a practice.
Fantastic. One last question I have for you. What's one lesson you've learned running an allied health practice that you don't often hear about, that may not be popular, may be uncomfortable to hear?
I'm not sure about it being uncomfortable. Again, let's talk about a qualitative and a quantitative. The qualitative, I would say, is never underestimate the benefit that the patient experiences from the interaction with the client as much as the intervention with the client. So that's from a clinical qualitative viewpoint. The interaction must be valued as much as the intervention. And that goes for your whole patient experience journey, customer service, etc. From a business point of view, you need to make things a little uncomfortable for yourself in order to grow and succeed, I believe. But any risks you take need to be calculated, and you must know your financials, to my earlier point. So understanding your profit margin, including yourself as a reasonable wage, and understanding your benchmarks is critical. So invest the time and the money to help understand that. Your business will run more successfully.
Fantastic. So, if any of the audience would like to reach out to you, what's the best way I could learn more about your philosophy, or do you have
Yep.
content that you produce and connect with you?
Yeah. So the best way to do that, Barry, is to go onto my website, which is businessconsulting.com.au. What you'll see on there is I've written a number of insights into business performance and business valuations, selling, preparing to sell, what is a clean P&L, those sorts of things. So there's several insights and resources that help upskill you in some of those common questions that we hear from time to time. It'll give you the opportunity to book a free consultation with me, and that's through a link. It'll ask you some questions about what stage of business you're at, from startup to growth to scale to exit and sell, to give me an idea of where you're at. If you can also follow me through LinkedIn, I put up regular blogs on the same sort of topics around growing and scaling, succession planning, exit, and then obviously a few topical things that are industry relevant. So the most recent one is the Health Professionals and Support Services Award Gender Equity Decision and plans there. There's obviously some information about to be released around the NDIS pricing that's coming up. So I'll tend to try and include some of the more topical things in our industry that business owners need to be aware of, which all really dovetails into some of those elements that I was talking about around clinic performance and business performance.
Thanks for sharing that. It was very generous to have you share all that. In this, there's a lot to unpack there, even from me hearing that. So yeah, thanks for your time, Ben, and hopefully we might have a follow-up conversation in the future about a similar
Pleasure,
different
Barry.
topic.
Thank you for having me, and happy to support anytime.
Thanks, Ben.